Welcome dear students in tube. It is also known as auditory tube or pharyngotympanic tube. It connects the middle ear with the nasopharynx. This small 36 mm long tube is of utmost importance, and I can say it is one of the marvels of nature as to how this tube functions and why it has to be present. So let us learn everything in detail about Eustachian tube, its anatomy, its functions, its disorders and its functional tests. Let us begin by learning the anatomy. The other names for Eustachian tube are auditory tube and pharyngotympanic tube. Pharyngotympanic connects nasopharynx with tympanic cavity, also known as middle ear cavity. This tube is 36 millimeters long. Now let us see the direction of Eustachian tube. The auditory tube faces downwards, forwards and medially. This is the direction of auditory tube. To explain once again, is it medial or lateral? It is medial because it is connecting the middle ear with the nasopharynx. Is it upwards or downwards? It faces downwards because the middle ear is somewhat higher. It faces downwards because the middle ear is at a somewhat higher level than the nasopharynx. So it faces downwards. And is it forwards or backwards? Obviously it is forwards. So the direction of Eustachian tube is downwards, forwards and medial. And it is not straight. It lies at an angle of 45 degrees with the horizontal. This is the angulation of Eustachian tube, and this is very important that it lies at an angle of 45 degrees because in infants and children it is more or less horizontal and that causes certain problems. Let us learn further about the Eustachian tube in adults and children, but for now remember that in adults it is at an angle of 45 degrees to the horizontal. Now, coming to the parts of Eustachian tube, let me write that down. It is directed downwards, forwards and medially. And it is at an angle of 45 degrees with the horizontal. Now let us study about the parts of Eustachian tube. It is divided into two parts, a bony part and a fibrocartilaginous part. Now when it is coming from the middle ear is more or less covered with bones on all its boundaries. The anterior wall is made up of the anterior wall of middle ear is made up of bone, the posterior wall is made up of bone, the roof is made up of bone. So it is a bony structure. The middle ear is more or less a bony structure except on the lateral side where there is tympanic membrane. So which part of Eustachian tube is bony? The posterolateral part. If this is the Eustachian tube, this part, the anterior part is medial and the posterior part is lateral. So we call this as posterolateral and the front part this as anteromedial part. So let us now see the two parts of Eustachian tube. Bony part and fibrocartilaginous part. As we already know, the posterolateral part is bony, whereas that part that is present close to the nasopharynx is fibrocartilaginous. It is anteromedial. And the bony part is 1/3 of the tube and fibrocartilaginous part is 2/3. 1/3 of 36 millimeters is 12 millimeters and fibrocartilaginous part is 24 millimeters. This is about the anatomy of Eustachian tube. In between the junction of bony and fibrocartilaginous part, there is a narrowing to the tube and that narrowing is called as isthmus. What is isthmus? It is the narrowest part of the tube. The bony part of Eustachian tube is towards the middle ear and the fibrocartilaginous part is towards the nasopharynx. And this fibrocartilaginous part is made up of a single piece of cartilage. It is made up of a single piece of cartilage. This cartilage is in such a way that it folds upon itself and it forms the entire medial lamina. Now anterolateral 2/3 is fibrocartilaginous and this cartilage forms the entire medial lamina, the roof and also a small part of the lateral lamina. The rest of the lateral lamina is formed by a fibrous membrane. This small part, lateral part is fibrous membrane. The rest of it, the entire medial lamina plus the roof plus a small part of lateral lamina is made up of a single piece of cartilage. So this cartilage is forming medial lamina, roof and a small part of lateral lamina. The rest of the lateral lamina is formed by a fibrous membrane. Now this Eustachian tube is open on both ends. Both the sides it is open. It's not a blind tube. So let us see what is present on each of the openings. First, let us study about the tympanic opening, the opening present in the middle ear. It is very simple. The tympanic opening, as we already know, it is bony and its dimensions are 5 by 2 millimeters. 5 by 2 millimeters. And where is the Eustachian tube opening in the middle ear? It is opening on the anterior wall. Yes, correct. It is opening on the anterior wall of middle ear. The Eustachian tube opening is one of the important structures that are present on the anterior wall of middle ear. Next, we have the pharyngeal opening. This is the opening that is present in the nasopharynx. And this is slightly more important. Now this pharyngeal end is not a circle. It's not a complete opening. It is just a slit. It is just a slit-like opening. It is situated in the lateral wall of nasopharynx. If the nasopharynx is like this, it is towards one corner of the nasopharynx. It is coming from the middle ear and it is on the lateral wall of nasopharynx. Slit-like opening on the lateral wall of nasopharynx. Where exactly is it present? It is present 1.25 centimeters behind the posterior end of inferior turbinate. Let me repeat. In the nasopharynx, the 3 nasal turbinates are present and lowermost is the inferior turbinate, and that inferior turbinate has one anterior end and one posterior end. From the posterior end of inferior turbinate, if you go 1.25 centimeters behind, there you will find the opening of Eustachian tube on the lateral wall. This entire thing is present on the lateral wall only. 1.25 centimeters behind the posterior end of inferior turbinate. We know that at the pharyngeal end there is cartilage that is present. Now this cartilage at the pharyngeal opening raises into an elevation, and that elevation is called as torus tubarius. It is present on the posterior end. What is torus tubarius? It is the elevation of the cartilage. Elevation of the cartilage at the pharyngeal end on the posterior side. If this is the tube and this is the opening, on the posterior side, somewhere here is the torus tubarius. On the posterior aspect of pharyngeal end. It is important that you identify the torus tubarius while examining the nasopharynx. Now, just like torus tubarius, there is one more important structure, or I can say a more important structure, and that is fossa of Rosenmuller. Fossa of Rosenmuller. Where is this present? And what is this fossa of Rosenmuller? Posterior to the torus tubarius, there is a depression, and that depression is called as fossa of Rosenmuller. A depression present posterior to torus tubarius. And why is this fossa of Rosenmuller so important to us? Because this is the most common site for nasopharyngeal malignancy. And that is why fossa of Rosenmuller is important. And it is essential that we understand about this structure because it's a small depression that is present on the posterior end. Unless you are aware and you consciously search for fossa of Rosenmuller, it is not visible easily. That makes fossa of Rosenmuller important. Its predilection for malignancy plus its more or less hidden location. Okay? With this, we complete learning about the pharyngeal end, opening at the pharyngeal end of Eustachian tube. Now, there are three muscles present here at the pharyngeal end itself. Let us learn about them also. What are those three muscles? The first one is tensor veli palatini. If you say tensor veli palatini or tensor palati, it is one and the same. They both mean the same. Next is levator veli palatini or levator palati. They both are the same. Next is salpingopharyngeus. These are the three muscles that are present in the pharyngeal end of Eustachian tube. And what is the function of these three muscles? They all open the Eustachian tube. They are all dilators of the tube. That is the function of all these three muscles. They keep the tube open, they dilate the tube. Tensor veli palatini is supplied by mandibular branch of trigeminal nerve. And these two muscles are supplied by vagus nerve. This is about the muscles that are present there. Next, we need to study about two more structures, and they are, with this we have completed learning about the pharyngeal end now. And there are two more structures of the Eustachian tube that we need to learn, and they are elastin hinge and Ostman's pad of fat. First, let us see what is this elastin hinge. At the junction of the medial and the lateral lamina in the roof, the cartilage is very much rich in elastin fibers. And these elastin fibers present on the roof, there are these elastin fibers at the junction of the medial and lateral lamina, and they form a hinge, and that is called as elastin hinge. Now this elastin hinge helps us to keep the tube closed. That is the importance of elastin hinge. Once again, where is the elastin hinge present? It is present in the roof. Where exactly in the roof? At the junction of medial and lateral lamina. The cartilage over there is rich in elastin fibers. The cartilage is rich in elastin fibers. And this elastin hinge helps to keep the tube closed. The three muscles there, they help open the tube. And when they are not acting, the tube has to be kept closed, and this elastin hinge helps in keeping the tube closed. The next structure that we must learn is Ostman's pad of fat. What is this Ostman's pad of fat? As the name clearly suggests, it's a mass of fatty tissue. It is essential that the tube remains closed to prevent the reflux of nasopharyngeal secretions into the middle ear. We will learn more about the functions of the tube later, but for now remember that the Ostman's pad of fat is a mass of fatty tissue. It is present lateral to the membranous part of cartilaginous tube. And just like the elastin hinge, this also helps to keep the tube closed. Now here are two pictures showing the open tube and the closed tube. Here the tube is closed. This is a closed Eustachian tube, and this is an open Eustachian tube. This entire part is cartilage, medial lamina, and the small part is the membranous part present on the lateral lamina. And normally when the tube is closed, it is just a slit-like opening, as you can see in this diagram. It sometimes opens like this with the help of these muscles. Tensor tympani, repeat, tensor palati, levator palati and salpingopharyngeus. And behind what you can see is the Ostman's pad of fat. This is how the Eustachian tube looks at its pharyngeal opening when it is closed and when it is open. To complete the anatomy, let us learn about the histology of Eustachian tube. The innermost layer of Eustachian tube, the mucosa, it is lined by pseudostratified ciliated columnar epithelium. Pseudostratified ciliated columnar epithelium, and in between the epithelial cells are interspersed goblet cells. Next, the submucosa is rich in seromucinous glands. Seromucinous glands are present in the submucosa. Now, what is important here is that it is lined by ciliated epithelium. What is the function of cilia? They propel secretions anywhere in the body. Cilia beat in one particular direction in such a way that they cause movement of substances from one end to the other end. That is the job of cilia. So, why are cilia present here? They drain the secretions and fluid that is present in the middle ear into the nasopharynx. The direction of beating of cilia is such that they propel the secretions from the middle ear into the nasopharynx. This is how the Eustachian tube helps in clearing the middle ear infections, clearing the fluid in the middle ear. So the cilia propel the secretions and fluid from middle ear to nasopharynx. Direction of movement is very important. It is from middle ear to nasopharynx and not the other way round. So this is about the histology of Eustachian tube. Next, let us understand about the nerve supply. The Eustachian tube is supplied by tympanic branch of glossopharyngeal nerve. Now, if you remember the middle ear anatomy, there was this tympanic plexus present on the promontory and it was formed by glossopharyngeal nerve, and the glossopharyngeal nerve itself supplied the entire middle ear cavity including the medial surface of tympanic membrane. So the same glossopharyngeal nerve supplies the Eustachian tube also by its tympanic branch. It supplies both sensory and parasympathetic secretomotor fibers. This is about the nerve supply. And when we examine the Eustachian tube from the pharyngeal end, how can we examine? By doing posterior rhinoscopy, or a rigid nasal endoscope can also be used to help us identify the pharyngeal end. Let us see how it looks. This is how the Eustachian tube looks on endoscopic view. Actually, this is the endoscopic view of the nasopharynx. Let us identify the structures present here. This slit-like opening that you are seeing here, this is the opening of Eustachian tube, the pharyngeal opening. The elevation that is seen here, this elevation is torus tubarius. This another fold you can observe here if you see carefully. This is actually fold of levator palati muscle. There is another important structure that we need to identify, that is fossa of Rosenmuller. I told you it is kind of hidden behind the torus tubarius, posterior to the torus tubarius. Here behind this is the fossa of Rosenmuller, the most common site for nasopharyngeal malignancy. Now this picture is very, very important, both from examination point of view and also clinical point of view. If an endoscopy is done and shown to you on the monitor, you should be able to identify various structures present in the nasopharynx, especially the Eustachian tube opening and the fossa of Rosenmuller. The torus tubarius is of course prominently seen and there is no confusion. Now the tube has to be kept open when necessary and it has to be closed when not necessary. So certain factors present in the nasopharynx can influence this opening and closing of the tube, such as some nasopharyngeal masses, adenoids and all the structures. To see them, we have to examine the nasopharynx, the pharyngeal end of Eustachian tube. Next, coming to the tympanic end, we cannot observe the tympanic end because it is present deep inside the middle ear. But if at all there is a perforated tympanic membrane, we do not perforate the tympanic membrane to examine. If at all there is a perforated tympanic membrane already present, then we can send a small endoscope through it and look at the tympanic opening of the Eustachian tube. Now with this, I complete the anatomy of Eustachian tube. Let us now look into the functions of Eustachian tube. Why should a Eustachian tube be present? Why do we need a structure connecting the middle ear and the nasopharynx? Because it has three important functions and they are: the first function of Eustachian tube is ventilation and regulation of middle ear pressure. Ventilation and regulation of middle ear pressure. For normal hearing, please understand the pressure is decided by the ambient atmosphere. It is the same pressure as the outside atmospheric pressure. So the middle ear has to adjust its pressure in accordance with the ambient pressure. Only if both these pressures are in equilibrium, normal hearing can occur. Now how does the middle ear adjust its pressure? By the Eustachian tube. Here is where the Eustachian tube comes into play. The Eustachian tube is normally closed. It opens periodically once in a while to equalize the air pressure in the middle ear with that of the ambient pressure. Otherwise, the rest of the time, the Eustachian tube remains closed. How does it open? When we swallow, when there is some sneezing activity or yawning activity. In these three conditions, the Eustachian tube opens, and whenever it opens, it equalizes the pressure of the middle ear with that of the ambient pressure. Now this opening is less efficient in lying down position because there is venous engorgement. When somebody is lying down, when they are in the recumbent position, there is venous engorgement, and that makes the opening of Eustachian tube less efficient. Plus, the opening of Eustachian tube is poor in infants and young children. That is why in that age group, in the age group of 7 to 10 years, they suffer more from these middle ear problems. Why? As I told you, the Eustachian tube in children is horizontal, plus the opening is less efficient. So what happens is it cannot equalize the pressure properly, plus the draining activity and ventilation of middle ear by Eustachian tube is not done properly, and that leads to frequent middle ear infections in children of the age group less than 10 years. At 7 to 10 years age, the Eustachian tube becomes normal. So the first function is to equalize the pressure. Let me write that down quickly. The Eustachian tube opens periodically to equalize the air pressure in the middle ear with that of the ambient pressure. Now the Eustachian tube normally remains closed. It opens during, I told you, 3 activities. One is swallowing, next yawning, and also sneezing. By this, it regulates the middle ear pressure and it also provides ventilation to the middle ear. It lets in air into the middle ear. The next function of Eustachian tube is a protective function. There are 2 ways by which the Eustachian tube protects the middle ear. One is it protects the middle ear from the reflux of nasopharyngeal secretions. Now the nasopharynx often has secretions, and secretions in that area are acceptable because they can easily trickle down into the oropharynx and go down into the throat. Otherwise, they are in contact with the external environment. They can move into the nose and they can be blowed out. But if at all these secretions via the Eustachian tube go into the middle ear, it causes infection in the middle ear and that is harmful. And this reflux of secretions is more if at all the tube is wide in diameter, if it is short in length, and also if the tympanic membrane is perforated. That is why if the tympanic membrane is perforated, there is more reflux of nasopharyngeal secretions, and that is one of the reasons why there is persistence of middle ear infections in the presence of a perforated tympanic membrane. So the Eustachian tube, by remaining closed and also by the direction of cilia, prevents reflux of nasopharyngeal secretions. The next function is, what are the situations where the reflux of nasopharyngeal secretions into the middle ear is more? It happens in 4 conditions, and they are: reflux is more if 1. The tube is wide in diameter, short in length, if the tympanic membrane is perforated, and when there is high pressure in the nasopharynx. When will there be high pressure in nasopharynx? When there is forced nose blowing. When there is forceful nose blowing. Do you know when this happens? When somebody is suffering from common cold and the nose is full of secretions and they try very hard to blow out everything. You also observe this when parents usually advise their children to do so. When very small children of the age group 2 or 3 years are suffering from common cold and they're trying to blow out whatever nasal secretions are present, parents usually advise them to blow harder. The intentions are good so that the child clears up all the secretions and remains free with a free nasal passage for some time at least. But the problem with forced nose blowing is it can propel the secretions into the middle ear. Now, as such, the child is having common cold, rhinitis. By this activity, the child will suffer from otitis media also. So, advise parents or advise anybody not to blow their nose very, very forcefully because these secretions can go into the middle ear via the Eustachian tube. Second situation when there will be high pressure in the nasopharynx is when we do closed nose swallowing. Why would someone swallow with their nose closed? Nose closed in the sense basically there is some obstruction in the nose. Say nasopharynx adenoids, adenoid hypertrophy present in the nasopharynx. In all such situations also, when there is some obstruction to the nasal passage and the patient is swallowing, that lead to a high pressure in the nasopharynx, and in that high pressure, these secretions can go into the middle ear via the Eustachian tube. So the Eustachian tube remains closed and prevents this reflux. Now the second protective role of Eustachian tube is that it prevents high sound pressures from the nasopharynx to be transmitted to the middle ear. These high sound pressures will be transmitted if the tube is kept open. The tube, by remaining closed, will prevent the transmission of these high sound pressures from the nasopharynx into the middle ear. If at all these pressures are transmitted, it interferes with normal hearing. So, for all these things, the tube normally remains closed. What is the second protective role? It prevents transmission of high pressure sounds. High sound pressures from nasopharynx to middle ear, which can otherwise interfere with normal hearing. For these things, the tube remains closed. And finally, there is one last function of the Eustachian tube after protective function, and that is clearance of the middle ear secretions. Clearance of middle ear secretions. How? What is the lining of Eustachian tube? Ciliated epithelium, ciliated pseudostratified columnar epithelium. So these cilia beat in the direction of nasopharynx and consequently clear the secretions and debris of the middle ear. The cilia clear the secretions and debris of middle ear by beating towards the nasopharynx. This is also a very important function of very important function of Eustachian tube. And this clearance of secretion is enhanced by active opening and closing of the tube. Whenever the tube opens and closes actively, the secretions are propelled. Now, all these functions of Eustachian tube, do you know when do you realize the importance of Eustachian tube? During air travel, especially during landing, Many people experience acute pain in the ear, especially if the ambient pressure is not maintained properly. I'm sure you must have observed other people at least suffering with ear pain during flight travel. Why does that happen? Because the Eustachian tube is locked and it fails to open, and the ventilation of middle ear is not happening, and that will lead to severe pain in the ear. And if you complain this to the air hostess, what they do is they give you a glass of hot water. And if you observe back many years ago, they would give chocolates during air travel. The purpose of drinking hot water or putting a chocolate in your mouth is to swallow. And when you swallow, what happens? The Eustachian tube gets opened. And when it opens, it ventilates the middle ear and solves all this problem. But we do not eat chocolates in the flight. If they give chocolates also, we put it in the handbag. Many people do that. Children eat. So, this is when you will understand the Eustachian tube's importance during air travel, and more so when it gets blocked. So let us understand the disorders and functions of Eustachian tube in the next video, but for now I hope you have understood the anatomy and physiology of Eustachian tube clearly and properly. Thank you very much and have a nice day. Let's meet in the next video. Thank you.